So today we're going to be talking about the rubella virus, most commonly known as measles. So let's get started. What is the rubella virus? It looks something like this, and it is in the I'm sorry, I can't really say that, family, and this is the virus that causes measles. It is spherical in shape. It's spread by RNA virus with spikes of glycoproteins poking out of it, and this helps it to bind with a cell. Transmission of measles. Measles is spread by personal contact, airborne droplets, and it can actually live 2 hours in the air that a person with measles has coughed or sneezed in, so it's highly contagious. It's spread by airborne droplets, personal contact, saliva, and touching a contaminated surface. Infection and symptoms of measles. So some symptoms would be cough, runny nose, high fever, watery and red eyes, Koplik spots, which are basically like white spots in the mouth, a measles rash, which looks something like the picture on the right, and symptoms appear 7 to 14 days after exposure. And also, people who are contagious, they can be contagious 4 days before the rash appears, as well as 4 days after it goes away. So this also makes it kind of hard to track and pretty contagious. Complications of measles. Brain swelling, which is also called encephalitis. Pneumonia. According to the CDC website, about 1 in 5 people who get measles will actually be hospitalized. Diarrhea is another complication. Ear infections. And you're most likely to have complications if you are under 5 years of age, older than 20 years of age, if you're pregnant, and if you have a compromised immune system. So where does measles primarily live? Or I guess I should rephrase that. Where is it most likely to occur? It's very common in many countries. It is less common in the United States. However, according to the CDC website, from 2018 to 2019, the number of people with measles has actually more than doubled in the United States, and this could be because of people not getting vaccinated and because of travel. Prevention. Since this is such a fatal, in some cases can be fatal disease, it's important to know how to prevent it. So the most important way is to get you and your family immunized. And if you are going to travel and you do not know if you are immunized or if you've had measles before, then you should get a blood test to check if you are immunized, because that's the only way that you can tell. And remember that this virus is highly contagious, so if you know somebody that has measles, stay away from them. And if you've already had measles, then you're probably immune, but the only way to really find out is a blood test. And here's my sources, and I hope you enjoyed it.